Welcome to our Community Health Assessment for Buncombe County, North Carolina. Buncombe County is located in the western part of North Carolina. Our focus will be obesity in the African American male population. According to Buncombe County's 2015 Community Health Assessment, obesity and chronic disease prevention were a #1 priority issue. Our focus for our community assessment was Shiloh Community, one of the oldest African American communities in Buncombe County, established in the 1880s. They recently partnered with City of Asheville to maintain diversity of residents and limit encroaching developments. Their focus is to provide more affordable housing. Our Windshield survey, as you can see in the photos, mostly ranch and craftsman style homes in the 1960s, with construction, vinyl siding, occasional brick versus brick facade. Most homes had either central air units, some window units noted in mobile home parks. The general appearance was well kept and updated, predominantly fenced-in yards. Common neighbors were noted in the front yards, bike riders, kids playing, and dog walking taking place. Very little pedestrian traffic was noted. One possible street person noted. No loose animals. The condition of the area was well kept. Mowed lawns. The Shiloh community is defined by roads, one major interstate and two smaller highways, bordered on the west by Wilson Creek. The transportation noted was mostly cars, lots of parallel parking noted, very few bike riders, bus route with limited times noted. There were social service centers, 2 parks within the neighborhood, baseball field, track, 2 playground areas, recreational center with job postings boarded noted in the window. Information on signs was very limited. No billboards. Health indicators. 3 miles to the nearest hospital. Bus line available. No evidence of substance abuse centers. 1 mental health facility specializing in developmental delays. 2 available grocers, Ingles, which is a large chain, Hope & Company, discount grocery store. They were able to reach by bus, multiple transfers would be needed, no direct route via bus route. Mostly fast food noted, Bojangles, Starbucks, convenience store, gas stations. 2 local restaurants were Juicy Lucy's and Moe's Barbecue, selling mostly fried foods, hamburgers, and sandwiches. There were also no evidence of farmers markets, or fresh food and vegetable stands. Race and ethnicity, mostly African Americans, 1 Caucasian male using the track at the recreational center, group of young African American kids walking a dog, 2 African American male bike riders, no ethnic specific stores or restaurants noted, and all signs were in English. Religion, predominantly black church congregations noted, Baptist. Politics, there were 2 polling places identified, no party-affiliated headquarters noted, some political signs in the yard, only Democratic signs noted. No heavy industries noted, mostly retail and hospitality on the community border, Ingles, Advanced Auto Parts, ABC Store, Bojangles. Mass employers were UPS, Care Partners Rehabilitation Hospital, and Missions Hospital. Our informant interviews are noted as Anika C., which is a Shiloh community resident. She's 41 years old, a physician clinical assistant, and a native of Buncombe County. Suzanne C. is a diabetic nurse practitioner with Mission Hospital, has been an RN for 44 years, and an advanced nurse practitioner for 22 years. As you can see, they are seen in the community as a source of medical information. When Suzanne's asked what chronic condition she sees most with obesity, her response was diabetes and hypertension. Anika explained that obesity was a concern of her and the community, was specifically mentioned diabetes and high blood pressure. Also asked what she sees as the biggest obstacle for adequate health care, Anika states affordable housing is the biggest financial burden. High rental rates and home prices take funds away from available healthcare spending. Suzanne was asked what contributors to obesity she sees in her African American clients. Her response is economic barriers, such as unable to afford healthy diets, too many starchy foods and breads that are more affordable, medications are too expensive, and the lack of insurance. Anika points to culture as a contributor to obesity. She states most families prepare Southern style fried foods at home, lack exposure to different types of foods. When asked recipes and methods of preparation are handed down to each generation, they're less likely to prepare other types of foods and afraid to branch out. Suzanne, when asked what contributing factors to compliance with recommended treatment for diabetes and other conditions, responded medication compliance, knowledge deficit regarding sliding scale insulins, with lack of proper glucose monitoring, and lack of resources. She states some of her patients will purchase glucose meters but are unable to afford supplies that accompany them. Anika, when asked financial concerns, another contributor to obesity, she said fresh foods are expensive, processed items are cheaper, organic is more expensive. Points to different family structures as contributing to obesity. Anika states many single parents households opt for quicker, cheaper options, fast food, and takeout. Suzanne, when asked denial, one of the biggest obstacles she faces with clients despite race. Many of her patients ignore diabetic diagnoses until faced with a crisis. She says younger patients fail to see long-term consequences of noncompliance such as renal disease and vascular problems. She expressed concerns for elderly patients with diabetes due to risks of vision impairments and difficulty seeing markers on insulin syringes. She states family support for the youngest and oldest patients also crucial for compliance with diabetic regimens. Anika, again, when asked what the biggest concern in the community regarding obesity was, she said diabetes was number one concern. Hypertension was number two. Again, she indicated salt as a leading to higher prevalence of hypertension in her community. When asked if there were obstacles in her community preventing adequate health care, Anika responded, tradition and mistrust of modern health care. Some community members try home remedies before seeking medical care, and it's what we've always done is how some community members respond. Suzanne asked if there are any programs to help patients face barriers to treatment, and she replied, she refers patients to case management to find them assistance. Also mentions affordable medication program sponsored by Walmart. They specialize in affordable diabetic medication supply. Anika, her interview continues. When asked about obstacles preventing adequate health care, she said lack of financial resources, explaining some community members can afford an office visit, but then are unable to pay for prescriptions that may be warranted after the visit. She states they have to prioritize what medications they can afford. Asked if there were programs available in the community to combat obesity and related conditions, she replied that health screenings at local churches do diabetic screenings, cholesterol screenings. She explained this is sometimes the only medical treatment some of her community have available. She also states that people in her community attend church, and this is the best place for outreach programs. During our secondary analysis, Buncombe County at a glance, their population is 238,318 people, with a median age of 41.7, a median household income of $46,900. Percent below poverty level is 14.8. Statistics from Buncombe County, 23.5% of adults are obese. Population at risk, current obesity rates by race, Black is in the lead with 47.8%. African Americans comprise 6.3% of Buncombe County residents. Obesity and chronic disease prevention is identified as the number one health issue in Buncombe County. Top contributing factors to obesity in Buncombe County are food insecure community that have lack of nutritious food options, food desert areas, and proximity to food sources, physical activity barriers, neighborhood safety, and digital device distraction. Factors contributing to obesity according to community respondents. Nutrition, again, physical activity, and knowledge deficit. Cost of obesity is around $210 billion spent annually on obesity factors related illnesses. $14.1 billion annually on prescription drugs and outpatient costs, and $237 million spent on inpatient expenses. Contributes to $4 billion spent on absenteeism and job loss. Obesity impacts are 30 chronic health conditions and is responsible for a quarter of all healthcare costs. It is one of the biggest risk factors that impacts our health. Our community strengths are community outreach programs through a group of African American churches. Local churches are very active in the community and partner to conduct health screenings for diabetes and high cholesterol. Strong family supports for the youngest and oldest patients. Weaknesses noted are culturally traditional Southern cooking and high fatty meats, starches, and salt. Little availability of healthy food options, fast food restaurants noted, and no farmers markets. High housing costs leave little left over for healthcare spending. Our top health issue is obesity prevention in the African American community of Buncombe County, North Carolina. Top 3 health issues affecting the community is obesity, puts individuals at higher risk for many chronic diseases, diabetes, knowledge deficit on glucose monitoring and sliding scale insulins and cost for medications and supplies, and high blood pressure. Our community diagnosis is increase in health problems related to obesity among African Americans in Buncombe County related to limited availability of healthy food options and barriers to opportunities for physical activity as evidenced by 2.9 times higher rates of diabetes than the Caucasian population. Our primary interventions would be education is key. We would create an educational leaflet on risk factors associated with obesity, advertisement of contact information with tips for healthier food choices by phone, social media, or apps, and create simple handouts of exercise regimens that people can do at home to help with weight management. Also, creating simple recipe booklets to share with local community centers with quick, healthy, cost-effective meals would also be a primary intervention. Our secondary intervention, we would hold community fairs where people can come and get free check of their weight, BMI checks, vital signs and blood glucose level checks. Provide references for people if at risk based off screening results, and provide people in the community with resources on affordable and healthier food choices such as farmer markets. Early detection of the disease is the key for preventing further complications. Our tertiary intervention would be to motivate people in the community to increase physical mobility by creating free community exercise groups in local churches and community centers. Educate people in the community on small changes that one can make in their everyday life to increase daily physical activity. Organize weight loss support groups where people in the community can attend in person or through social media. We also may assist community leaders with applying for grants to create local food banks with more healthier choices. References are noted on the next 2 slides. What I've learned during this project is that obesity is a challenged public health condition that can be managed with exercise and diet control. If left untreated, it may lead to more chronic conditions such as heart disease and diabetes. How has this learning experience influenced my current or future nursing practice? It makes me look at the individual as a whole, looking at their surroundings by their community, their financial resources, and hereditary influences. I will continue to educate at-risk clients in order to prevent further complications.